Why do candidates fail the RCA? Today we're going to look at 3 reasons why candidates fail, and hopefully that will help you to avoid making the same mistake. The first reason is submitting low challenge cases. If you submit a low challenge case, then it doesn't give you the chance to score well because there's not many opportunities to demonstrate your capabilities as a safe and independent GP. The second reason is candidates don't correctly mark their cases. Maybe they are not sure how to mark their cases, but it's an important step before submission. It's very important that candidates are self-critical in marking their own cases. Reading the marking sheet will help you, but you need to also understand the marking sheet. Don't just read it, but study it, because each word in the marking sheet has been put there for a reason. The third reason is poor selection of cases. If you think about it, each case in the RCA can score you up to 18 marks. So if you submit a poor selection of cases, it's going to affect your overall mark. And I know some candidates have unfortunately failed by 1 or 2 marks. So make sure that you have the best selection of cases that showcases your capabilities as a safe and independent GP. You might be asking yourself, how do I know whether a case is low challenge or not? Deciding whether a case is challenging or not will depend on your level of experience and capabilities. A case might be challenging for you, but less challenging for another registrar who might find it straightforward. When we think about how challenging a case is, it is useful to think about 4 different domains. These include diagnosis, management, patient, and situation. The first 2 domains, diagnosis and management, will aid you to think about whether a case is clinically challenging or not. The last 2 domains, patient and situation, will add layers of complexity to a case. Presentations such as chest pain, weight loss, tiredness, and menopause will require more clinical judgment, and the diagnosis is considered to be moderate to high challenge. Some areas of the curriculum topic have been associated with low score. These include ENT and eye problems. If possible, I would recommend that you avoid any straightforward cases, as these would cap your marks for the RCA. The second domain that determines whether a case is challenging or not is the management. Are you having to work hard in the management, or you're not having to do much in the management and you're not adding much value in the consultation? For instance, if you're consulting with a patient who knows everything about Crohn's disease, and in the management, the patient's already mentioned about the treatment options and what they want to do, then because you're not having to discuss a lot and you're not doing much, then it doesn't give you much opportunities to score well in the case. So it would be considered as not very challenging. However, if you're consulting a patient who does not know anything about Crohn's disease and you're having to explain this, discussing the pros and cons of the treatment and what is the next step, then this gives you more opportunities to score well for the RCA, as you're having to do more for the management. If you're managing a patient who is presenting with chest pain and your management is to refer the patient to attend A&E, while your recommendation may be reasonable, for the purpose of the RCA, you may not score well if you submit such a case, as you're not having to do much in the management. On the other hand, if the patient declines to attend A&E, and you have to discuss risks and consequences, that this could be potentially life-threatening, and having to arrange for an alternative management by seeing the patient face-to-face and arranging ECG to investigate for any pathologies and treat the patient in the community, then you may score more in the case. A common trap that registrars fall into is trying to make a case look more complex than it actually looks. If a case is straightforward, don't try to make it more complex, because examiners can see what you're doing, and you're unlikely to score well if you're trying to make a mountain out of a mole. The third domain is patient. If a patient has unrealistic expectation, has some psychosocial problem, then this adds a layer of complexity to a case. For example, if a patient declines admission to hospital because he has lost his wife in the hospital and has got really bad traumatic experience of being in the hospital, then this makes a case much more complex than another patient who might agree to go to hospital and follow your recommendation. Another example is if you're consulting with a first-time mother who is very anxious about her baby, then you're having to reassure her, and she might have some expectations that you need to discuss. Then this adds another layer of complexity to a consultation. Patient's ideas, concerns, and expectation may be straightforward or maybe more complex depending on what they're presenting with. So this would add another dimension to a consultation. Last but not least is a situation. For example, if you have a patient who is newly diagnosed of TIA, who happens to be a taxi driver and is currently in financial debt, this adds a layer of complexity because of the financial implication of not being able to work. Another example is if you have a single mother who presents with heroin addiction. Because of the fact that she's a single mother and there's a child in the picture, this adds a layer of complexity as there may be cause for concern due to child safeguarding. So the circumstances around the patient's home and work would add a layer of complexity to a case. So it's important to inquire about the psychosocial aspect of a case and be able to address these problems. The college has been very clear about cases considered to be low challenge. These include medication requests, repeat prescription, medication review. Pill check is also a straightforward case that can be completed by an advanced nurse practitioner. These cases are not challenging because they are straightforward. They can be done easily. I would avoid submitting follow-up cases because the history has already been taken earlier and you're not starting from scratch. It's best to use a new case for the RCA where you're starting from scratch and you're taking a history with new information. Recurrent cases tend to be straightforward as the patient already knows about the problem and they have already been treated previously with the same problem. So it might not be a good case for the RCA. I would avoid submitting cases where discussing results with patients because it's also considered as a follow-up appointment. You're not starting from scratch and some of the information has already been gathered by another practitioner or by yourself earlier. So it's difficult for you to score well on these cases. Last but not least, sick note requests or fitness to work are considered to be straightforward. I would avoid submitting these cases. It is crucial that you benchmark your case using this grid that you can see. Think about the clinical challenge. Think about the diagnosis, the management, whether you're having to work hard in the management. So that will give you an indication as to whether it's low challenge or a high challenge case. Then think about the patient and situation. This will add complicating factors to the picture. Whether there are multiple factors present in the case, these include patient expectation, belief, psychological issues, social situation, or if they have hidden agenda. This would influence on the level of challenge in the consultation. Ideally, you want to submit a case that has some complicating factors, that has some level of clinical challenge in it. A case that falls in the green zone would provide good opportunities for you to score well as there would be evidence of your capabilities as a safe and independent GP. Be careful that you don't pick an extremely challenging consultation that has multiple complicating factors and that has a high clinical challenge because it might be difficult for you to complete it within 12 minutes. On the other hand, don't submit a low clinical challenge case that does not have any complicating factor because it provides very limited opportunity to display capabilities as a safe and independent GP. How do you mark your cases? It's crucial that you're self-critical when you're marking your cases. Be sure to not only read but study the marking sheets so that you get an understanding of what examiners are looking for when they mark your cases. I'd like you to think of the marking process for the RCA as if you are the examiner, because when you're thinking from an examiner's perspective, then you would see what examiners are looking for. Examiners are looking for someone who can show capabilities to work as a safe and independent GP. The first domain to analyze when you're marking your case is a global consultation. Then you may analyze data gathering, clinical management, and interpersonal skills. What are we looking in the global domain? Is this consultation an organized one or disorganized, unstructured? Is this a dysfunctional consultation? Have the priorities or issues in the consultation been recognized? Does a candidate use time appropriately or is a poor use of time? Ask yourself whether this is a consultation that is suitable for the RCA. Is this a good consultation? Make sure that your video does not feature excessive exposure of patients. Once you have analyzed a global domain, then you may proceed with data gathering. Ask yourself whether the history is focused and allows a safe assessment to take place. Are you eliciting new information in the history? Are you asking about presence or absence of red flags to help rule in and out significant disease or serious pathologies? Are you making any consideration of a diagnostic hypothesis? Are you eliciting the psychosocial aspect of the history and the impact on the patient's work and home life? If you're offering an examination, are you explaining this examination succinctly? Have the issues and priorities in the consultations been recognized, or are you going down a rabbit hole? Clinical management is a domain that many registrars struggle with. So be honest and self-critical when you're analyzing your consultation and marking your consultations. Are you making a safe and appropriate working diagnosis? It's so important to come into a working diagnosis because then your management is going to be more robust. If you don't verbalize a working diagnosis, then the patient doesn't know what you're managing and the examiner has no clue what you're managing, and it's likely to be more wishy-washy plan that is tailored to your patient's preferences and need, or you're offering a generic management plan. Make sure that you use evidence-based medicine. If you're prescribing a medication, make sure you specify what medication you're prescribing, what dose, how frequent the patient needs to take it, discuss the side effects, and make sure that you discuss and verbalize it, because when you're doing that, it helps the patient and the examiner also understand what you're doing. If you're referring a patient, then let the patient know why you're referring them and what do they need to expect. For example, if you're referring a patient under a 2-week wait referral pathway, let them know when they need to be seen and what would they expect, and if they don't hear anything within 2 weeks time, to call the surgery back so that the appointment can be chased. Are you making appropriate use of your time and resources whilst attending to risk? If a patient is asking you for an MRI scan on the back because they're suffering with back pain and you don't think this is indicated, how are you going to manage that expectation appropriately? The college has reported that some candidates give generic safety net advice, calling 111, calling 999, and the patient is confused and doesn't know what to look out for. So it's important when you're providing safety net advice, be very specific so that the patient know what are the signs to look out for when they need to reconsult. If you're going to bring a patient in the next half an hour or 1 hour, then it sounds awkward when you're telling the patient to call 111 if this happens or if that happens. So make sure that your safety net advice is appropriate and in context. If need be, arrange for follow-up appointment to show continuity in the consultation. The next domain is interpersonal skills. This is a domain where candidates struggle because they're not listening actively to the patient, they're asking about ideas, concern, and expectation, and they don't address these. It's important that you not only ask for these ideas, concern, and expectation, but also to address them in the second half of the consultation. Otherwise, patients will have unmet needs and still be confused and concerned because you have not addressed these ideas, concern, and expectation. If you're asking a patient about something sensitive, be sure to signpost your questions. A common misconception that candidates have is shared management is about sharing options with your patient. It's important that you show that you're involving your patient in the management decision and reaching a shared understanding and be able to help the patient make a decision. If you're just sharing options with your patient, then they might not be able to make a decision as to which is the best for them. So your job to help them to make that decision. So discuss the pros and cons of each option, make your professional recommendation, and enable the patient to make their own decision. If you're conducting an examination, make sure you're sensitive, obtain valid consent, and offer a chaperone if it's an intimate examination. Be sure to avoid any use of jargon. So make sure that the language that you use is simple and your patient can understand your explanation. You will get a maximum of 3 marks if you show capabilities as a clear pass 2 marks if you show capabilities as a pass, and 1 mark is failure. Clear fail is 0, where you may be doing something that's dangerous. How do you score a clear pass? For a clear pass, you need to demonstrate a high level of competence. You need to justify your clinical approach and show fluency in the consultation. It's very important that you're focused and technically proficient. The choice of the case is very important because you need to choose a case that shows sufficient evidence to demonstrate capabilities in the domains discussed. The clear pass candidate shows sensitivity, actively share ideas, and may empower the patient. How do you get a pass? A candidate demonstrates an adequate level of competence with clinical approach that may not be fluent. So there might be some break in the consultation, but is justifiable and technically proficient. As you can see, a lack of complexity can restrict the achievement of a clear pass grade. For a pass, you still need to show sensitivity and try to involve your patient. How do you select your 13 cases for submission? Let's go over the mandatory criteria. So you need to have 1 case involving a child aged 16 or younger. This is a pediatric case. Make sure that the case is a pediatric problem. What you want to do is to submit a case that show your capabilities of managing a pediatric case. For example, you could submit a case of bronchiolitis, enuresis, or constipation. You need to submit a minimum of 1 older adult. This is an adult over 65 years old. This is something that I don't think you would struggle to find because there are many patients who are over 65 presenting. So make sure that you get a case that's suitable for the RCA. These include cancer, osteoarthritis, congestive heart disease, rheumatoid arthritis. Let's go over the essential clinical criteria. You need to submit a minimum of 1 case involving an acute problem that needs urgent investigation or referral. This would be an urgent referral or a 2-week wait referral or same-day admission. You need to submit a case of maternal and reproductive health. This could be cases such as nausea and vomiting in pregnancy, miscarriage. I would avoid submitting any cases of breast lump as you're unlikely to score well. You need to submit a mental health condition case. This could include anxiety or depression or stress at work. Last but not least, a long-term condition. This is an established condition that the patient has got. It is not a new diagnosis. It is a patient who has already been diagnosed of a long-term condition. This could include a cancer, diabetes with complications. I would recommend that you aim to get the cases that fulfill the mandatory criteria at an early stage of your preparation so that you're not stressed later. Then if you get a better case, then you can replace it with another case as your consultation gets better. Would you like to take your consultation to the next level and work one-on-one with me? I'd love to connect with you. Book your free 15-minute call today and I'll get in touch with you shortly. I look forward to talking to you. If you found this video useful, then I've got another video that I'm sure you're going to gain a lot from. This is a video where we talk about the common challenges that GP registrars face. And hopefully you're going to learn how to manage patients who are talkative, who present with multiple problems, and time management. Thank you for watching this video until the end. Take care everybody. Bye bye.